Allergy to marijuana, cannabis, can occur. If you are allergic, the protein that is the allergen can cause an allergic reaction if ingested or smoked. The odor itself would not likely cause an allergic reaction. But the smoke, which can contain the allergen in the vapor, can cause respiratory symptoms. The risk of reaction would be if you are around this person while they are actively smoking. If they are ingesting it, then kissing could potentially be a risk. So far, people have found that a weed allergy occurs under different circumstances. The symptoms vary depending on one's contact with different aspects of cannabis. Most often, the pollen from marijuana plants causes reactions in some people. Allergic reactions can happen when you touch, eat, smoke, or even accidentally inhale cannabis pollen. Depending on the route through which it reacts with the body, like skin contact, inhalation of pollen, etc., cannabis allergies are reported to produce a wide variety of symptoms, most of which are typical of other allergies. In a report from Canada's CTV News on the emerging trend of cannabis allergies in the post-legalization era, Toronto-based immunologist and allergy expert Dr. Gordon Sussman said that more exposure to marijuana among the general public will inevitably lead to more reported cases of cannabis allergies. Sussman has seen a rising number of cannabis-sensitive patients over the past 10 years, and is actively studying the phenomenon of undiagnosed cannabis allergies to raise awareness and better prepare physicians. Those with cannabis allergies can develop allergy symptoms similar to dermatitis, which include itchy skin, hives, or puffy eyes. There are a number of reasons why you might hesitate and ask, can you be allergic to weed? There are causes to consider before, or even after, you consume or touch cannabis. These can include 1. Sensitivity to marijuana after prolonged, continuous use. 2. Allergy to certain proteins present in marijuana and other foods such as apples, bananas, tomatoes, and chestnuts. 3. Terpenes in the strain, caryophyllene, pinene, linalool, and limonene can cause a weed allergy. 4. Allergic reactions to dust or mold that might form on stored weed. 5. Pollen from marijuana or other plants. 6. Specific allergy to cannabis sativa, use other strains instead. 7. Increased asthma symptoms from smoking cannabis. 8. A low or compromised immune system automatically tries to fight off the chemicals in marijuana. This can result in a marijuana allergy. Marijuana allergy is a fairly recent discovery that many have been surprised by. Unfortunately, recent decades of studies show that humans can be allergic to just about anything. Luckily, there's hope. If you suspect you're averse to weed, you can get a diagnosis in several ways. Asking your allergy doctor, "Am I allergic to weed?" will prompt him to run some tests on you to determine this. He'll conduct a simple skin test using a diluted marijuana allergen. If your skin reacts badly within 15 minutes, this may indicate an allergy. He could also inject a small amount of the diluted marijuana just under the surface of your skin. You may have an allergy to marijuana if your skin breaks out in hives, itchiness, or red spots. Skin tests and injections produce fast results, but getting a blood test is safer and more accurate. It won't interact with any medications and won't result in a severe allergic reaction. It may be more expensive and take a few days, but it's generally a better option. The doctor tests for an allergy to weed by drawing some blood from you and sending it to a lab. The lab tests your blood for specific antibodies that may be reactants to marijuana allergens. The more these antibodies you have, the more likely you have an allergy. Of course, you can diagnose a cannabis allergy yourself by paying attention to your reactions when consuming it. You know yourself better than anyone. You can diagnose an allergy if you feel bad after smoking or ingesting marijuana. Humanity has come far through the progress of technology and medical treatment. Luckily, if you're allergic to weed, it doesn't necessarily mean you have to avoid it altogether, except in extreme cases. The most common cause of an allergic reaction is the pollen from the marijuana plants. If you're sensitive to pollen, grass, or dust, antihistamines may be your answer. Consider buying some over-the-counter and taking them to alleviate weed allergy symptoms. Before you buy them, chat with your doctor about them. Some antihistamines cause drowsiness, so they may negatively interact with the effects of marijuana and result in further dizziness or disorientation. Ask your doctor or pharmacist for non-drowsy medication. If you struggle with asthma, get some asthma medication to alleviate symptoms. Try to avoid smoking marijuana and consume it in other forms. These include edibles, tinctures or cannabis oils, or weed capsules and tablets. Prescription or over-the-counter treatments for a weed allergy include 1. Albuterol inhalers. 2. Inhaled or intranasal corticosteroids to treat inflammation. 3. Nasal decongestants. 4. Allergy shots. Speak to your doctor or allergy specialist about specific treatments. They may advise you to avoid weed altogether, but, hopefully, they'll direct you to the right medicines or preventatives. These won't exactly cure a cannabis allergy, but they at least help alleviate some of the symptoms. Was this helpful? Kindly like, share, and subscribe to our channel.